Everyone, how are you? Let's talk about oxygen transport in blood today. So, oxygen actually is carried in blood in two forms. One is dissolved in blood or plasma, and another is, which is the more important part, which is bound to hemoglobin. And hemoglobin at its normal concentration increases the oxygen carrying capacity of blood about 70-fold. So here is a look into hemoglobin, which is a tetrameric protein. So it has four subunits: 2 alpha, alpha 1, alpha 2, and 2 beta, beta 1 and beta 2. So this is also called the adult hemoglobin. So this is the globin portion or globin chains, and inside each of the globin chain there is one heme molecule or heme moiety attached to it. So this is a globular protein. So hemoglobin is a globular protein of 4 subunits. Each subunit contains a heme moiety and also a globin moiety, which is iron containing porphyrin. So the iron in heme moiety is the ferrous iron, which is very important to remember. And this iron actually binds oxygen. So this is the active portion of the heme. And each subunit has a polypeptide chain, as I've already mentioned, and the polypeptide chain actually determines what type of hemoglobin it is. And the normal adult hemoglobin actually has 2 subunits of alpha and 2 of the beta subunits, leading to an alpha 2 and beta 2, which is called adult hemoglobin. Hemoglobin can exist in 2 structural forms. One is taut form and another is relaxed form. The taut or T form is found when the hemoglobin is deoxygenated, and the deoxygenated hemoglobin form has a low affinity for oxygen. And the relaxed or R form is the oxygenated form, which has a high affinity for oxygen. Actually, it has 300 times more affinity for oxygens in R form than comparison to taut form. So hemoglobin actually exhibits positive cooperativity and negative allostery. The positive cooperativity actually causes the increase in high affinity for oxygen in relaxed or oxygenated forms, and increases in chloride, hydrogen, carbon dioxide, 2,3-bisphosphoglycerate, and temperature actually favor the taut form over the relaxed form. And as you can remember from your oxygen hemoglobin dissociation curve knowledge, that the taut form is actually the form that has a low affinity, and if there is a decrease in affinity for oxygen, the oxygen hemoglobin dissociation curve actually shifts to right or shifts in favor of tissue. So in the tissue you have this kind of situation. In the tissue you have high hydrogen, high carbon dioxide, and high 2,3-BPG. So in the tissue you need to increase oxygen unloading, and that's what's happening here. So in the tissues you have a more taut form, which causes an increased oxygen unloading, which is actually favorable for tissue. The fetal hemoglobin actually has 2 gamma subunits in spite having 2 beta subunits, and it has actually a lower affinity for 2,3-bisphosphoglycerate. And as it has a lower affinity for 2,3-BPG, it has a higher affinity for oxygen, because 2,3-BPG actually is a substance which actually lowers the affinity of hemoglobin for oxygen. And you can remember from our previous slide that the hemoglobin is actually in taut form in tissues and relaxed form in the respiratory tract. So those important concepts should be memorized and should be remembered, and is very important in answering questions. And hemoglobin also acts as a buffer for hydrogen ions. And if somehow hemoglobins are modified, it would lead to decreased oxygen saturation of hemoglobin and ultimately decreased oxygen content. So one of the modifications or important modifications of hemoglobin is methemoglobin. And in case of methemoglobin, the iron in the heme is actually a ferric iron. So this is the oxidized form of hemoglobin, and this oxidized form actually does not bind oxygen as readily, but this oxidized form has an affinity for cyanide. So methemoglobin can present with cyanosis due to increase in deoxygenated hemoglobin and also chocolate colored blood. And you can actually induce methemoglobinemia by using nitrites followed by thiosulfate to treat cyanide poisoning, because methemoglobin has an increased affinity for cyanide. And methemoglobinemia actually can be treated with methylene blue, and nitrites and benzocaine can cause poisoning by oxidizing iron to ferrous iron to ferric iron and converting the hemoglobin to methemoglobin. Let's talk about the oxygen binding capacity of the blood. So the bound oxygen is actually bound to hemoglobin. So it's actually the maximum amount of oxygen that can be bound to hemoglobin in blood. And simply it depends on the hemoglobin concentration in the blood. And hemoglobin concentration is actually the limiting factor, that the amount of concentration that can be carried in blood. And it's the oxygen carrying capacity of oxygen binding capacity of blood is measured at 100% saturation of hemoglobin. Normally 1 gram hemoglobin can bind 1.3 milliliters of oxygen, and normal hemoglobin concentration in blood is about 15 gram per dl. So if 1 gram binds 1.3 ml, 15 gram would bind about 20 milliliter per deciliter, 20 milliliter oxygen per deciliter of blood. So this is the typical oxygen binding capacity in a normal hemoglobin concentration. And what is oxygen content of blood? So oxygen content is actually the total amount of oxygen carried in blood. So it includes bound form of oxygen and also the dissolved form of oxygen. So here is an equation for you. Oxygen content is equals to hemoglobin bound oxygen plus dissolved oxygen. And from the previous slide, you can remember that hemoglobin bound oxygen can be calculated by oxygen binding capacity times the percent saturation of hemoglobin. And cyanosis results when the deoxygenated hemoglobin is more than 5 grams per deciliter. And if hemoglobin decreases, there is decreased concentration of hemoglobin, there is decreased oxygen content of arterial blood. But there is no change in saturation of hemoglobin, and there is no change in partial pressure of oxygen in arterial blood. And we can calculate oxygen delivery to tissue by multiplying cardiac output with oxygen content of blood. So we can compare the differences between carbon dioxide poisoning, anemia and polycythemia affecting the hemoglobin concentration, oxygen saturation of hemoglobin and dissolved oxygen. So in case of carbon monoxide poisoning, the hemoglobin concentration is normal. But the point is, carbon monoxide has a higher affinity for hemoglobin. It competes with oxygen for binding to hemoglobin, so reduces the oxygen saturation of hemoglobin. But it doesn't have any effect on dissolved oxygen. So the dissolved oxygen and partial pressure of oxygen is actually normal, but as there is decreased hemoglobin bound oxygen, the total oxygen content of blood is reduced. In case of anemia, the hemoglobin concentration is reduced, but the percent saturation of hemoglobin is normal. The dissolved oxygen or the partial pressure of oxygen is normal, but the total oxygen content is reduced because the bound portion, the hemoglobin bound portion, is reduced as the hemoglobin itself is reduced. In case of polycythemia, the hemoglobin concentration is increased, but the oxygen saturation of hemoglobin is normal, dissolved oxygen is normal, and total oxygen content is increased. Because the hemoglobin concentration is increased, the hemoglobin bound oxygen concentration is also increased, leading to an increase in total oxygen content. So that's all from me today. Thanks all for watching my video.